Perhaps it is the shot in the arm that a COVID world needs right now. The first vaccine in the UK, and they're trying the same in other countries too. Or is it too soon to celebrate, with many saying they don't trust the jab and with its real effectiveness as yet unknown? You're watching Roundtable. Hello from me, David Foster. One elderly lady from Coventry in the English Midlands said it was the best early birthday present she could have hoped for, as she gets ready to turn 91 next week. And maybe a corner has been turned in beating this coronavirus, but there are likely to be many more bumps in the road ahead. 90-year-old Margaret Keenan became the first person in the world to have the groundbreaking Pfizer vaccine. It marks a new phase in the global fight against COVID-19.
Hopefully it'll help other people to come along and do as I did, you know, try and do the best to get rid of this terrible thing.
Other countries are expected to begin vaccination programs soon. 4 million doses are likely to arrive in the UK by the end of the month. The UK government has prioritised the elderly and at-risk groups as well as health workers to receive the vaccine first, but it is a huge logistical challenge.
How's that?
The British Prime Minister, Boris Johnson, said it will take months before all the most vulnerable are protected. Senior health officials say it is vital that people get the vaccine.
We need people to take it. This vaccine isn't going to help you if you don't take it. And you will need 2 doses of this vaccine and most of the others to have full protection. Watching others take it and hoping that this will then protect you isn't going to work necessarily.
But according to one poll this year, almost 1/3 of Britons would not take a coronavirus vaccine or do not trust it. So what are the biggest challenges ahead as COVID vaccines are rolled out? Well, 3 guests who've been on Roundtable before. We welcome back Oksana Pyzik, Global Health Advisor and Lecturer at UCL School of Pharmacy. We go to Nottingham and say hello again to Jonathan Ball, Professor of Molecular Virology at Nottingham University. And in Oxford, Sian Griffiths, Emeritus Professor of Public Health and Primary Care at the Chinese University of Hong Kong. Sian, about 4 or 5 months ago, you were on the programme saying you were surprised at the speed with which vaccines were being prepared. Even so, now that we have them being used in the UK and tested elsewhere, are you still surprised at what's happened so quickly?
I think surprise is the right word, David, because when we started out talking about vaccines, we were used to vaccines taking years to develop. But through this pandemic, what we've seen is a fast acceleration of the process. And so now we have many vaccines at various stages of trials, but particularly, of course, we've got the Pfizer biotech that's been actually now for the first time today put into use. So it has been a very rapid process and far faster than I think any of us expected.
Has it been rushed?
I don't think so. I mean, if you think of the amazing resources that have been put towards this, there's been fantastic global cooperation between scientists, pharma companies, governments, and there's been a lot of money. And often one of the rate limiting steps in getting to the end point of a vaccine has been, are the resources there. It was able to build on the research from the SARS outbreak in 2003. It took a while in 2003 to recognize it was a coronavirus that was causing the epidemic. And by the time people got going on the vaccine research, actually the SARS SARS virus had disappeared out of the population. So, but there had been some initial SARS research and also research with MERS, and so it wasn't as if it was a totally blank piece of paper. But we have seen some amazing new ways of delivering and developing vaccines, and also a huge response from the public who've been willing to come forward to act, to support the trials. So I think it's been an exceptional period in which everyone has realised that really the vaccine was the only way out of this pandemic at the end of the day. And I think, it's a combination of all those factors, but it has been far quicker than we expected. And I think quite a few of us were probably quite cynical when politicians were claiming that we'd have a vaccine by Christmas. We have a vaccine by Christmas. We have maybe more than one vaccine by Christmas, and that is good news.
Okay, Jonathan, Sian says it hasn't been rushed in her opinion. Your thoughts on that? And what are the dangers of using something so quickly that is, in a sense, untested properly?
Well, I wouldn't necessarily agree that it's not been tested properly. We know that this has been the culmination of a very contracted set of clinical trials. So we've had phase 1, 2, and 3. So they were designed to look at safety initially, and then safety and efficacy or effectiveness. And we know that the vaccines have performed probably better than we expected or anticipated through that process. And I think it's because of the risks that governments and manufacturers and scientists themselves were prepared to take in terms of rapidly developing things rather than waiting for one set of results before moving on to the next set of work. They've been able to run different parts of the clinical trials in parallel, which has meant that we could generate that safety and that efficacy data much more rapidly. And of course, ultimately, the regulator is the body that decides whether or not something is safe and effective. And for one of the vaccines,
excuse me though, when I said not tested properly, what I actually meant was we still don't know what might happen in the longer term.
No, we don't, and this is true for any new treatment or any new medicine. But what will happen after licensing is that there is a continuous reporting of any very rare adverse effects. And this is true for any treatment. Any phase 3 clinical trial will recruit tens of thousands of people very often. What it won't be able to do is recruit literally millions of people that will be expecting to receive these vaccines in the next few months around the world. But post-licensing monitoring will tell you about very, very rare adverse effects, and anything that does appear will be reported, and the regulators will reassess whether or not they're happy with those vaccines. So this is nothing new, and we should be reassured that that is just the normal process, the normal way of things.
Oksana, before I come to you for a question, let's hear what Boris Johnson had to say.
I'm extremely proud and impressed with what the NHS is doing this morning. But it will be right the way through for the next few months. So I just urge people to contain their impatience. It's a very, very exciting moment, but there's still a lot of work to be done and a lot of discipline to be maintained.
So there we have the British Prime Minister. He's upbeat, he often is. Do you share his optimism, Oksana?
Well, this is fantastic news in terms of taking the first step towards ending the pandemic, and we hope that there will be other vaccines that follow suit, including the Moderna and AstraZeneca Oxford vaccine, which are the other front runners, particularly as the AstraZeneca one has more ability to vaccinate the world due to its easier storage requirements and its price point. It's much more affordable. However, this is still some time away, and even here in the UK, there are only 800,000 doses, and Pfizer has already made the statement that they will only really be able to manufacture 1.3 billion doses for the year, and that's certainly not enough for the world. So although there is much good news in terms of this being a huge scientific achievement, we will have to carry on with public health restrictions, with social distancing and face masks for a while, given that people who are young and healthy, those who will be receiving the vaccine much later may not even get it until 2022. So we should not expect things to snap right back into normal immediately. So I think there should be some also realism about what this news actually means.
Jonathan, I'm going to come back to you because it was something I meant to ask but forgot to at the time. Does this vaccine, the Pfizer vaccine I'm talking about here, does it mean you don't get COVID, or does it mean you can't transmit it? What does it actually do?
At the moment, unfortunately, we don't have any insight, any knowledge as to whether or not these vaccines protect from infection and therefore prevent you from transmitting virus. And if we look at the data for some of these vaccines that was obtained in animal studies, we know that the vaccines very often protect the animals from the symptoms, particularly pneumonia. But what they fail to do is to protect the monkeys from infection, and very often those monkeys produced an allowed replication of the virus in the nose and in the throat. And so in theory, if the same thing happened in humans, then you could see transmission of the virus from people who are vaccinated. And I think that's why the initial aim will be to protect the most vulnerable people in our populations from severe COVID disease. And the reality is that if the vaccines work as effectively as we're led to believe, if they truly are 95% effective in the most vulnerable population, then that does mean that there is light at the end of the tunnel much faster than otherwise we could expect. Because if you could protect the vulnerable people.
As a non-scientist here, let me just ask you as a member of the public, does it simply mean that if you get it, you won't feel quite so bad, you won't be as sick as you would have been if you had not had it? It could be something rather like just having a bad cold.
Exactly. So, you know, it's all about reducing the appearance of symptoms of the coronavirus. So that has been the measure that they've used in the clinical trials, whether or not somebody has had any of the recognized symptoms of coronavirus infection. And we know that the vaccines have protected people very effectively from having those symptoms.
So let me throw this one to Sian. It seems that Jonathan is suggesting that you're just not going to feel quite as bad as you might have done. If people know that, they're going to think, well, I can just go out and do what I like, really. It's just going to be like a sniffle.
Well, the big problem is that we need to protect the elderly and the vulnerable, particularly in care homes first. And as we get more experience of the vaccine, we'll understand more about what it's actually doing over time to the transmission of the disease. So this is an ongoing sort of scientific study at the same time as protecting the population. I think the key thing here with the vaccine rollout is that this particular vaccine will be going to those very vulnerable, the over 80s, those in care homes, their carers, and then those in the NHS who are looking after them. By the time we get to be rolling out the vaccine to other groups, it may well be different vaccines we're rolling out to other groups. And we'll need to look very carefully at how those vaccines are working and understand the science. So this is a really, I don't like to say an ongoing scientific experiment, but it is in a way a scientific study as the vaccines rolled out, because we're going to get answers to the things we don't know over time. All we do know is that this is an effective vaccine and it's a safe vaccine. It's a first step.
It's a first step. I want to ask you what you think is going on in other countries. We're going to show some pictures of people getting the jabs in Russia. President Putin has rolled this out for key workers, saying that it will be effective, but at the same time they're doing trials there. And I want to ask you whether you think there is going to be some vaccine point scoring going on in the future.
Well, I think we have seen that a little bit. We have seen China has had a vaccine that's being used internally in China, the Sputnik vaccine, it's called, the Russian one. And then we did see Anthony Fauci inferring that our vaccine use in the UK, the appraisal of vaccine use in the UK had been done too rapidly. And then he actually withdrew those remarks. So you do see a little bit of, I suppose, joshing is the word, about, are we first or not? Actually, as other people keep really emphasizing, it isn't a matter about being first. It's how do we distribute the vaccines that are available to us across the world's population? How do we make this a global effort so that people in low-income countries and middle-income countries where the vaccine isn't being produced or there isn't the funding to purchase it still benefit from the vaccine? And so moves such as the creation of COVAX, which is through the WHO, which is the global agreement that will get vaccines to lower income countries. All of this is a very important part of how we view vaccines. And so it isn't a race. If there are safe vaccines that are available and available to other countries, then hopefully they will be distributed appropriately and we won't see the hoarding of vaccines by one country or another.
Well,
so I think this is quite
something
complicated.
Sorry, Sian. This is something that Oksana mentioned when talking to our producers. You were concerned, about vaccine hoarding. I'd like to know what that is, and a potential black market.
Certainly. So when we think about beating COVID, we can't really do it one country at a time. And we've already heard about the WHO's effort in trying to ensure that countries commit towards also low and middle income countries being able to have access. Unfortunately, the Pfizer vaccine has been 80% of it has already been bought up by high income countries. So that is concerning in terms of, despite vaccine hoarding is when we look at individual countries keeping the vaccine for themselves. And really, that just prolongs the whole pandemic, which is a higher price tag overall. We think about emerging markets, they contribute 74% to global growth. So we do need to ensure that they have some vaccines as well. And so that this vaccine nationalism doesn't become the mainstay. And the other problem is when it's only available in one part of the world, as you say, a black market emerges, because whenever there is a shortage and high need, this is where we see these gaps can be filled by organized criminal groups. And Interpol has on December 2nd issued a warning to 194 member states to say that this vaccine is a prime target of organized criminal groups, both physically and online. So even to the extent that some drug makers have gone on to create fake storage sites and fake paper trails to ensure that they have extra precautions against theft and diversion. And then there's the whole online aspect again, where people who may be at risk, who cannot access the vaccine, will go through this other route to try and access them. And we see that already occurring all over the world for essential medicines pre-pandemic. The WHO has said 1 in 10 medicines worldwide is either substandard or falsified. And that's really driven by a lack of access issue.
So, Jonathan, let me ask you about different vaccines. This Pfizer one we know has to be kept at extremely low temperatures. I think it's minus 70 degrees centigrade. The Oxford vaccine doesn't have to undergo such processes, as is the case with other ones. Are we going to see the Pfizer one replaced by other ones, even if they're not quite as efficient, because they're easier to distribute and to handle?
That's a really interesting question. And I think what we have to keep in perspective and keep in mind is that for some countries, and yes, it's the more wealthy countries, maintaining that kind of cold chain, whilst a challenge, it isn't impossible. And therefore, one would hope, particularly for vulnerable groups, for example, that you may well prioritize your best, your most effective vaccine in those groups. And of course, what we don't know yet is whether or not all of the vaccines will be as effective in those vulnerable groups at the moment. And that we will get more insight in as those vaccines are rolled out. But certainly around the rest of the world in low middle income countries, and maintaining that cold chain will be more challenging, and therefore you could anticipate that there may be rollout of less effective vaccines in those places purely because the logistics of it is so much easier. But we have to remember that even the poorest data that we have at the moment is still a very effective vaccine, and we would expect over time for more vaccines to be introduced, and therefore hopefully people can eventually take their pick and decide on which is best based on effectiveness, cost, and also ease of use.
And what about if you've had the Pfizer vaccine and suddenly somebody comes along and says the Oxford vaccine is better? Does that mean you won't be able to get the second one, or can you have one on top of the other?
At the moment, we don't know how long any of the immunity will last, and that it could last for several months, it could last for many years. We just simply don't know because the studies haven't been carried out. What I would say is at the moment, there's no real indicator, no evidence that there is any problem with having completed one course of vaccine. Now, certainly the advice and the expectation is that if you start a course of one vaccine that you would complete it. There would be no reason in future why you might not be able to have a second vaccine if the immunity for the original one that you had wasn't as potent, wasn't as effective, wasn't as long lasting. So I think, you know, these are all things which we will learn as more and more vaccines are licensed and we understand what their features are.
So, Sian, in the end, it's going to go back to which is the easiest, which is the cheapest, obviously, which is the most efficient. And people would hope to get to a stage where it was like when I was young and they just put a drop onto a sugar cube and you were immune to polio.
I think ease of distribution of vaccines is obviously a really important factor in terms of reaching, particularly reaching to, you know, the more hard to reach groups, the more hard to reach areas. So it will come down to that. Yes, it'll come down to a balance of how can we maximize the vaccines available, and as more become available, how do we get the right ones to the right people through, you know, logistic analysis.
Oksana, what real problems do you see as we move on with this? And there are maybe 2, 3, 4, 5 different vaccines out there. We know that there is some kind of herd immunity. Well, what do you think the major obstacles are going to be in getting it around the world and making sure that everybody who needs it takes it?
Well, part of it will be financial. So I bring this back to ensuring that we are able to purchase and supply in the countries that currently the WHO has only 2 billion doses that it aims to reserve for these regions. And then I'll just stress again that if we leave behind the low and middle income countries, ultimately this will just serve to prolong the pandemic. And that has an economic cost as well associated with it. You know, we've been spending over 375 billion every month, and we can avoid those costs if we're able to use these, not just vaccines, but ensuring that we also have some treatments, that there's still ongoing testing and tracing going on for people who don't have access to that. And that's still going to ensure that this global effort is able to continue. And without really seeing those either donors or countries coming in to help fund the COVAX facility, eventually this is going to be one of the largest hurdles. And of course, the second issue that has been mentioned previously by some are the vaccine hesitant and anti-vaxxer groups that have been spreading misinformation. We've heard from
well, we did a program about
Director General.
We did do a program very recently about anti-vaxxers. So let me go to Sian and talk about Public Health England. There's still going to be a heck of a job persuading people that this is the right thing to do, when I think it was only 66% of British people in a poll said they thought they would have it.
I wonder whether people will think differently now the vaccine is available. When it's a hypothetical question, you often get a different response from when you actually have the reality and the offer. And peer pressure may well play a part here, as well as pressure from children on their parents, you know, because it's going to be parents like me who my kids say to me, you know, you should have the vaccine, Mum. Jonathan Van Tam, the DCMO, the Deputy Chief Medical Officer, he's known for, you know, having phoned his mum up and say, you know, take the vaccine when you're asked to have it. I think family pressure, local pressure, peer pressure will all play a part, and it'll be very different when you're actually offered a vaccine than the hypothetical question.
Yeah,
I think
but for those that remember, those that study British politics, that may be rather similar to the Environment Minister John Selwyn Gummer getting his children to eat, yes, getting to eat beef when we had mad cow disease. Will you take the vaccine? This is a quick one for each one of you. Sian, you're on camera, so will you take it when it's offered?
I absolutely will take the vaccine. I think that it's an amazing, it's not just for me, it's also for people around me. As a public health person, I'm always saying to people, it's not just you. If we can get the levels of vaccine uptake in our population high enough, we're protecting each other. So I will take the vaccine.
Jonathan, will you do it?
Absolutely. I'm a bit down in the priority order, which in one way is a good thing. But certainly when it's offered to me, I will have whichever vaccine it is.
Yeah, and you would hope you might have a choice by then, yes?
There may well be a choice, although in truth it may well be that choice is made at government level, at Department of Health level, and they will decide based on the various characteristics of each vaccine what the best use of that vaccine will be. And we have to trust those independent committees who decide on vaccination strategy.
Oksana, will you have a jab if and when they come to you and say it's your turn?
I'm fully confident in the MHRA processes, and I will be more than happy to receive the vaccine when it is time. But as a 34-year-old woman with no underlying conditions, I imagine I'll be at the very end of the queue. But when the time comes, I'll be delighted to.
Very quickly, if you don't mind, does this mean we've beaten it?
This is not yet the end. As we say, we have to ensure that the vaccine is widely available. For now, our public health restrictions remain, but this is the light at the end of the tunnel.
You're very kind, each and every one of you, to come back for another grilling on Roundtable. Perhaps you'll do so again in the future, in a much, much safer world, we hope. Thank you, wherever you happen to be watching this programme. From me, David Foster, from the team that made it possible. Until next time, goodbye.